Hello, everyone, and welcome. My name is Meena Dayak. I'm the Executive Vice President, Market Intelligence at Open Minds. I will serve as the moderator for your web briefing today. We know that many of you are struggling with so many emergencies every day as we try to get through this pandemic and see light at the end of the tunnel. We appreciate everything that you are doing on the front lines. And we at Open Minds are here to help you with our new program, the Executive Blueprint for Crisis Management, Building Organizational Sustainability and Success in a Disrupted Health and Human Service Market. And through this program, we are providing web briefings like the one today, as well as technical assistance and a whole suite of on-demand resources to help specialty provider organizations like you navigate a market in turbulence. So today's web briefing is led by my colleague and Open Minds Executive Vice President, Tim Pisula. And today's will be the second web briefing in our Blueprint series. Tim is going to talk to you about getting funding through the CARES Act, a guide for specialty provider organizations. Tim brings over 3 decades of experience in financial accounting, medical practice management, and contract administration to the Open Minds team. And before coming to Open Minds, he founded a boutique IT and management consulting firm that provided services to the hospitality, healthcare, and telecommunications sectors. Earlier, Tim was the executive director of Fayette Health Management, a primary care system with hospitals and specialty physician practices. He also was the co-founder and chief operating officer of the Foundation Radiology Group in Pittsburgh, Pennsylvania. And on the fun side, while he finds the time, Tim is a certified amateur hockey coach and has coached youth hockey teams since 2014. And today, Tim is joined by Open Minds senior associates, Ken Carr and Steve Remillard, who will also be on standby to offer their comments and to answer any of your questions. Now, before I hand it over to Tim, just a couple of housekeeping reminders. Your audio is muted throughout the web briefing today, but we welcome your questions and comments. And the best way to send those in is through the question box on the right of your screen. You can send in your questions at any time during the briefing, and we will either interrupt him to ask them or wait until he is done with the presentation and bring them up. But Tim, Steve, and Ken will be on the line after the presentation for as long as it takes to answer all of your questions. Also, the slide deck, as well as a recording of today's briefing, will be available on the Open Minds website in a few days, and you will get an email about how to access it. With that, Tim, I will hand it over to you. Take it away.
Meena, thank you very much, and good afternoon and good day to everybody. Thank you for joining us for today's presentation. As Meena alluded to, we're going to be doing a deep dive on the CARES Act and how that can benefit specialty provider organizations. Without any further ado, we're going to jump right in here. Let me get my slide up. There we go. So today we'll be covering the following information. We're going to give you a high-level overview of the CARES Act. We'll talk specifically about the benefits to specialty provider organizations, and then we're going to review the application and how to process to take advantage of the various components of the CARES Act and how that can help you financially. Lastly, we'll get into resources for employees that are on furlough. And just wrap up with a summary. But today's presentation has a particular emphasis on how provider organizations can leverage the CARES Act to increase liquidity during these very difficult times. For a little bit of background, the coronavirus epidemic started in February, and the Trump administration quickly seized the day on the problem and declared a national emergency on March 13th. The Congress then went to work and passed on March 18th the Families First Coronavirus Response Act. These acts by the President and Congress were prequels to the passage of the Coronavirus Relief and Economic Securities Act, which we refer to as the CARES Act, on March 27th. The CARES Act provides $2.2 trillion in support to businesses and individuals affected by the pandemic and economic turndown. Again, today's goal of presentation is to inform you on the various means to take advantage of the CARES Act and the National Emergency Declaration that should improve liquidity of your business during these difficult times. These are the following relief programs and funding mechanisms we'll be discussing in greater detail. For provider organizations, there are a number of components here that we're going to get into in deep detail. And then there's also a set of benefits for employees that are impacted by the national emergency. So the act is roughly 800 pages long, and if you download and read it from the congressional website, you'll see that it's a lot of information. But we've been able to crunch this down to 6 components of the act that will help with your immediate liquidity needs. For example, Section 110, or excuse me, 1110 discusses in detail the emergency EIDL grants, and Section 1102 covers the SBA Express Disaster Bridge Loans. Section 1102 covers the Payroll Protection Program. 2301 covers the Employee Retention Credits. 2302 covers the 5-year carryback on net operating losses. And Section 4003 covers the Economic Stability Fund. I'm also going to give you a kind of an overview of traditional SBA funding options that you have that aren't part of the act, but I think they're important for you to realize what's available out there through the Small Business Administration. First and foremost is the emergency EIDL loans, which stands for Economic Injury and Disaster Loans. This is a vehicle that provides small businesses an immediate $10,000 grant to cover payroll, mortgage, rent, and other operating expenses. I'm told that the grants are paid via wire transfer within 3 days of application approval. The grants do not need to be repaid. There is a hyperlink there that will take you to the SBA website to complete the loan application. And there is an ability to get loans over $10,000, but they will go through a traditional SBA loan approval process. It may take a little longer, but we're told that even that process will be expedited, an expedited review and approval. So we'll come back to this link. There's several references to this link in the presentation, but if I was a practitioner or administrator for a practice, this is something I'd be pursuing immediately. This is free money from the government, and this is probably one of the key takeaways from today's presentation. I would be embarking on this application process today. The second component is the SBA Express Disaster Bridge Loans. These are loans that need to be processed through a traditional banker who has a SBA 7A loan program. So the key point here today is that if your organization does not bank with a provider or a bank that isn't an SBA loan provider, you may need to find someone that does, because they will play a very important role in helping you get these government funding mechanisms to help your business. Again, there's more information about the bridge loan package out on the SBA website, but the key point to take away from this slide is you'll need to have a relationship with an existing SBA loan bank provider. The SBA is saying they're going to approve other lenders that haven't traditionally been in the SBA loan program, but there's no word on how long that will take and what the qualification process will be for those lenders that have not participated traditionally in the SBA loan process. So my counsel to all of you is to find a bank that has an SBA loan program and work with them to help you on this. The next section is the Payroll Protection Program, or what we're referring to as the PPP loans. This is the marquee program of the CARES Act. It's designed to help you retain your staff during the crisis. This is basically a somewhat complicated process. There is a loan application form that is online. Again, this Payroll Protection Program loan mechanism will be processed through an SBA approved bank provider. So you can see that there's loans up to $10 million, but they're capped at 2.5 times the average monthly payroll for a prior year. Also, the entity had to have been in business on February 15th of 2020. What's important about this is this program is now available for nonprofits and for sole proprietors and independent contractors. So this is a very important distinction from past programs and past SBA loan programs where nonprofits and sole proprietors and independent contractors can now participate in these programs.
Tim, this is Meena. I am sorry to interrupt you, but can you clarify, out of the three that you have talked about so far, the EIDL, the Small Business Administration Bridge Loan, and the Payroll Protection Program, if a provider organization has limited resources in terms of going after these different sources of funding, would you recommend prioritizing one over the other, or would you say all of them are equally important depending on your situation?
Now, that's an excellent question. And the EIDL loans is priority one. They're basically giving you $10,000 per application for qualifying businesses. The qualifying process is a relatively low threshold. As long as there's documented tax returns for the entity, they're going to pretty much approve the EIDL loans as fast as they can. So that is obviously the high priority. The secondary priority is the Payroll Protection Loan Program because retention of staff is very key to long-term success during this disaster and emergency declaration. So again, I would reach out to banks that have an SBA program because they can expedite your participation in the PPP loan program. And then probably the third priority is the Express Bridge Loan because that approval process does take a little longer. Larger entities may ask for more than the $25,000 easy approval threshold. And you also need to have a banking relationship with an SBA, approved SBA lender. Did that help me?
Yes, that's wonderful. Thank you very much, Tim. Please go on.
Oh, you're welcome. So there's more information again here on slide 10. There's a qualifying look back period that comes into play on determining the amount that you can qualify for and what time frame you're looking at. In section 1106 of the Act defines the 8-week period beginning from the loan origination date for when these loans can be forgiven. So this is a key provision of this Payroll Protection Program, is that they'll advance you money or loan you money, and then you can qualify for relief. And literally 100% of your payroll costs for that 8-week period, they're going to forgive that. So if there's other expenses or looking at the look back period and analyzing that, you'll be able to have the majority, if not all, of this loan forgiven. If there's a circumstance where, say, for example, you borrowed $25,000 and only $20,000 of the used proceeds qualified as the expense reduction, you'll carry a $5,000 loan period that can be extended to a 10-year term with an interest rate cap of 4%. The nice thing about these loans is they're non-callable, they're booked as long-term debt, and it's really a very risk-adverse way to raise additional funds during this time of crisis. Again, the loan application is online. You can download the form, you can complete it, but the process really is to get that application into the hands of an SBA qualified banker. The last point I want to make on this slide is these loans are available through June 30th, so time is of the essence. You don't want to delay your application. I recommend that you start download the application today and start processing the loan app and reach out to your SBA approved banker to get this process going. On slide 11, this is a kind of a checklist for you for the information that can be compiled. Most payroll services provide this information to you fairly easily. With some providers, you might be able to pull this information yourself. The key point on the retirement fund planning in the last bullet on the slide is that you may need to get information from your third party or third party administrator, also known as a TPA. But if you get this information compiled, you'll have that, submit that with your application. We're told the process will go fairly quickly. The next big component of the CARES Act is Section 2301, which is also known as the Employee Retention Credits. This allows employers to postpone paying Social Security taxes from March 27 through December 31st of this year. And the key word here is postponing. You will need to pay these taxes eventually. They're specifying 2 tranches of repayment. 50% of deferment will become due on December 31st of 2021. And the second tranche, the other 50% will be due on December 31st, 2022. So again, this is, there's 2 ways of evaluating how many credits you get based on the size of your business. The threshold being 100 employees. For those employers with less than 100 employees, all their wages qualify for the credit, or all employees' wages qualify for the credit for the first $10,000 of compensation. So this is another means of deferring your quarterly tax payments as part of your payroll service. All the third-party payroll service bureaus are with the program on this particular component of the CARES Act. I would encourage you to reach out to them and to begin discussing how you do this. The other thing that I would recommend you do today is go to the IRS website, pull down Form 720, or excuse me, 7200. If you're not familiar with that form, I have a hyperlink in the presentation. You can Google search that as well. But that form will provide additional guidance on how to begin participating in the employee retention credits. If you're a medium-sized employer, this could be a very material way to defer paying these taxes and increase your short to medium-term liquidity. Again, I want to emphasize that this is just a postponement and that the taxes will be accrued but not paid until December 31st of 21 and December 31st of 22. The next big component of the CARES Act is the 5-year carryback on net operating losses. Prior to the passage of the Tax Cuts and Jobs Act of 2018, the IRS allowed businesses to carry NOLs forward 20 years or backward 2 years. The CARES Act revised that further, and they're now allowing you to do a 5-year look back on tax years 2018, 2019, and 2020. This is something that you'll need to consult with your CPA or whoever signs your tax returns, your tax preparer. But the idea of this program is that you can refile your 18, 19, or 20 tax returns using this NOL carryback, and that could yield a significant tax refund. Again, the only downside of this is you'll have to file an amended tax returns for each year for which an NOL applies. But nonetheless, you know, I'm aware of businesses that, you know, are looking to get a $50,000 to $100,000 windfall by refiling their tax returns with this 5-year carryback on their NOL. So while this is not in the core competency of what Open Minds does, we do understand how the program works. You will need to consult with your CPA or tax accountant for further guidance on this. There are entities, yours could be one of them, where taking a look at this could yield significant cash that would help you in the mere short term. The next program in the CARES Act is defined in Section 4003. It's called the Economic Stabilization Fund. This is a program that is administered through the Treasury Department and not the Small Business Administration. This applies only to those companies with more than 500 employees. And again, as I mentioned, the program is administered by the U.S. Treasury. It will be funneled through regional banks. Touched base with several banks this week. They have not gotten final guidance from the Treasury Department. But as you're talking to the banks about their SBA loan qualifications and programs, I would add this topic. If you're an employer of 500 or more, I would add this topic to the discussion and make sure that they're keeping you abreast of the rules that are forthcoming on how to apply for these particular loans. At first glance, reading the Act, this section deals with the airlines and the transportation industry. But if you read further into the details of the Act, any business that incurs a hardship due to the National Disaster Declaration, they qualify for this particular loan. The only caveat is it's for companies between 500 and 10,000 employees. We're now going to transition into a review of the CARES Act provisions that will help specialty providers through HRSA grants and other actions that should help you improve your service operations cash flow. In Section 3211, they discuss the provision of $1.32 billion to fund the community health centers. There are federally qualified health centers throughout the country. I did provide a hyperlink here that can take you right to the HRSA website. You put your state in, and it'll tell you exactly what center was designated to receive the grants. These have been predetermined, so I would encourage you to visit the website and see if you're affiliated with one of these centers, if they qualify for the grant. I think the key point to take away from this slide is the HRSA grant programs are targeting federal health centers, rural community health centers, and they're emphasizing quality improvement, increased access, coordination of care, and integration of services. If you've been a longstanding client of Open Minds, you know that our practice, we help providers get their arms around coordination of care and integration of services. So if you have any other questions about this, let us know, but we can do what we can to help you prepare for these types of requirements associated with this section of the CARES Act. On slide 16, this is the subsection of the Act designated for healthcare workforce. The key components are listed here. For example, in 3701, patients are eligible now to use their health savings accounts to cover telehealth services prior to reaching their deductible. So they'll be able to tap into their HSA prior to paying out of pocket for telehealth services. Expanding the 3703 covers the expansion of Medicare telehealth flexibilities, enables beneficiaries to access telehealth from a broad range of providers from their homes. And again, while these provisions are quote unquote in play during the national declaration, we get a sense that they most likely will be made permanent. I think the telehealth, the benefits of telehealth are very apparent, and our suspicion is that they will be made permanent at some point, probably after the first of the year of 2021. So you can see there's a consistent theme with these sections about telehealth. And there's also relaxing the rules where practitioners, whether you're a CRNP or a PA, can order home health services, as opposed to in the past it was restricted only to the attending physician. And probably one of the biggest things from an operational cash flow, there's actually two big things here that are part of the Act that will help operational cash flow, is the fact that they're suspending the sequestration relief. For you that aren't sure of what that means, CMS was required by law to implement across the board 2% rate cut. That has been postponed. We're hoping it's eliminated, but the rate reduction that was scheduled to go into place May 1st is now being postponed. And then Section 3720 amends the Families First Coronavirus Response Act to ensure that the states receive their Medicare increase to subsidize Medicaid programs. So this is if you have a large patient base that's Medicare, Medicaid, each individual state is expected to pass through these rate increases so that service of Medicaid patients becomes a little more financially viable. And then lastly, 3713 just talks about the fact that there's Part B cost sharing for COVID vaccine when it comes out. We're all anxiously hoping that we can get a vaccine out as soon as possible. On slide 17, just some additional provisions in the Act. They're titled under Health and Human Services. The big key here is that they've relaxed this rule on the RVU reimbursement rate. If you're a practitioner and you believe that your relative value unit of work is priced lower than the national average, this is something that could be incredibly beneficial to you. They're now indexing all provider RVU-based reimbursement rates to the national average. There's 3802 talks about the National Quality Forum or an entity like that to assist Health and Human Services in performing quality measurement and performance improvements through the rest of this fiscal year. Section 3803 extends low funding beneficiary outreach and counseling through November 30th of this year. That could be particularly important for behavioral health professional service providers. And then 3814 covers the mental health services demonstration that talks about coordinated care with mental health and substance abuse. That's been extended through the end of November. And then there's a couple other behavioral health programs here, 3821 and 3822. They're being extended to the end of the fiscal year as well. So the key takeaway on these provisions, if you need more information on these, let us know. We have a limited amount of time today, but there's certainly avenues for which that could help your operating cash flows.
Yeah. Tim, this is Meena again.
Yes,
and I just wanted to let people know that this slide deck with all of its links will be made available shortly after the presentation. We will send a link out to everyone. I'm also going to paste some of the links to the EIDL grants and stuff into the chat shortly. Can you just go over, Tim, and with all of these provisions and what's available to the provider organizations, what does eligibility look like? For example, if you want an EIDL grant, or if you want to apply for the Payroll Protection Program, what size of organization by number of employees are qualifying generally?
Well, that's an excellent question. So there's two issues here. Number one, you can be a sole practitioner, independent provider consultant. And if you've had a financial impact by this national disaster, you can apply for an EIDL loan and get $10,000. If you're a small practice with 10 or 15 employees, you're going to qualify for the EIDL loans. You're going to qualify for the Payroll Protection Program loans. The key is that even though there's $2.2 trillion worth of money out there, it's going to go on a first come, first served basis. We're getting word that Congress is already talking about putting additional financial resources behind these programs because they fear as though the laggards are going to lose out because the funds will be exhausted. And that's why I said the time is of the essence, that you got to get these applications in as soon as possible. If your bank that you normally deal with does not have an SBA program, you really need to find somebody that has an SBA lending program to help you with this. And they're going to want to help you. I've talked to a number of banks in the last 2 weeks. They're scrambling to get this together. I know one bank in particular who I had done business with in the past. They have a very robust SBO program, and they are adding resources to that, and they know that there's going to be a long-term benefit to serving those that are in need that aren't necessarily clients of theirs at this time. Did I cover what you were asking, Mina? I think I did.
Thank you, Tim. Ken or Steve, if you have anything to add to that at this time, I'd invite you to chime in.
Yeah, this is Ken, and I would just say that I think a lot of the focus with this first legislation in the CARES Act was on small businesses because they have so little reserves. And so, you know, when we talk about the large amount of money that was set aside, $349 billion set aside for small businesses, it's because there is that small razor of cash to kind of get them through the next few weeks. So, and there are a number of provider organizations with less than 500 employees. And that would qualify for this. And as Tim said earlier, I think you know, going after that EIDL loan makes a lot of sense. It's a great way to leverage your cash now. And the nice thing about the EIDL loan is you go right to the SBA website, you spend a couple hours with the application, and within 2 to 3 days, you get the cash. So that's a real immediate step any organization with under 500 employees can take. The PPP loans, I think the key there is connecting with the bank. You know, some of the large banks are already pulling back from taking applications for these loans. And what I hear today is, you know, your best option is your community banker. If you've got a banking relationship already, now is the time to reach out to that bank, especially if they have that connection with the SBA already. And so that really becomes the key. I think the challenge is for organizations with over 500 employees, and that's where we're still lacking some of the guidance that we need. The Economic Stabilization Fund, I think, will come into play, but the focus of that up to this point has been on the transportation industry, and yet there's a lot of money that will go to other organizations with between 500 and 10,000 employees. So the key there is be reaching out to your bank, even though the Treasury Department hasn't given out definitive guidance for how to access that money. Build that relationship now, begin to reach out to your banker immediately. I know there is a question also about the PPP loans. Some folks moved right away and ended up furloughing staff. They looked at their emergency plan, they looked at how much cash they had, and they moved right away to furlough staff. And one of the questions that we do see come up is, boy, if I already moved to furlough those staff, can I still access a Payroll Protection Program loan? And the answer is yes, there's a provision in there for that. If you rehire those staff back before June 30th, you can count those staff towards that forgiveness calculation. And so I think that that's something important to keep in mind too. So move forward with that EIDL loan if you have less than 500 employees. As a second step, you know, build that PPP loan through your bank and utilize those funds to kind of restore, maintain your talent, and move through this really critical period of the next few weeks.
Ken, that's good counsel. And again, I think at the risk of repeating ourselves, you'll need to find out if your current bank has an SBA loan capability, because if they don't, it may take some time for them to get qualified by the SBA to participate in this. And unfortunately, if they take too long, they may get into the program at the time the resources and the amount of money that's out there is exhausted. So again, hopefully the banks that you're used to dealing with or have a recurring relationship with have an SBA program. Most do, but some don't. And so it's important to assess that banking relationship as soon as possible. That aside, there's nothing that can stop you. There's nothing that should stop you from doing that EIDL application the minute this webinar is over. Okay, anything else? Thank you, Ken, for expanding on what we've talked about so far. On slide 18, these available SBA loan programs are not part of the CARES Act. But nonetheless, we are in a precarious financial times, and there are other programs that are out there that still might be able to help your organization long term. and I've documented them here. The traditional SBA loan program is called a 7A loan program, and those are part of the normal annual budgeting process with the federal government, and there's funds in there and those available for those programs as well. So that's why, again, we're emphasizing the banking relationship is of paramount importance at this time. Okay, so we're going to move on to slide 19, which is what I'm kind of characterizing as layman's terms summary review of the benefits of the CARES Act and of the of the National Declaration and related 1135 waiver. As you can see, CMS expanded coverage for telehealth services retroactive to March 6th via the blanket waiver. They're allowing fee-for-service telehealth coverage at the same rate as what was previously reimbursed for in-person services. That's probably the most dramatic impact of the National Declaration and the CMS waiver, 1135 waiver. The waiver is expanded now to cover telehealth services provided by practitioners, psychologists, dietitians. It's really opening up the mass acceptance and utilization of telehealth. Another big provision is helpful to growing your patient base is the waiver now excludes this prior relationship that used to be required, an inpatient relationship or an in-person relationship. You now can actually do an online assessment and call that the initial patient E&M. Also in bullet 5, during this declaration, the home-based telehealth services can be rendered using Skype or FaceTime, technologies that weren't necessarily HIPAA compliant as deemed in the past, but looks like for the balance of this year, perhaps the FaceTime and Skype were a reasonable way of providing telehealth services. And that kind of ties into number 6, which they've waived all the HIPAA penalties who use consumer-grade telecommunications technologies, which are FaceTime and Skype, in the process of providing good faith services. Another big point here is now interstate services are now permitted. CMS will reimburse you automatically for that, but you will be subject to payer credentialing in those states. Each payer has various idiosyncrasies about credentialing and reimbursing for interstate services. Distance site professionals, basically the act allows various centers to be designated as distance sites, and practitioners can use those as a that weren't previously designated as such. So these are community health centers, rural health centers. They can now be used as a distance facility for providing a telehealth services. Virtual check-in and e-visits are now permitted. We talked about the Medicare rate decreases being eliminated for the balance of this year. Medicare Part D has been changed to provide a 90-day supply instead of 30 days. And then the FMAP or the Medicaid subsidies are going to be retroactive back to January 1st. So that's a big win for those that are serving large populations of Medicaid patients. And then 13 just says that you're going to be testing Medicaid and CHIP and uninsured individuals with no cost sharing, and there are no federal penalties for doing so. This would probably be a good point to take a couple questions if we need them. If not, I'm going to move on.
Yeah, I would just, Steve, I know you are going to be diving into all things telehealth in a few days as you do a web briefing on April 23rd. But at this time, I was wondering if you wanted to add any additional insights based on all the expanded provisions for telehealth coverage.
Thank you, Mina. Yeah, and there was a question asking about when the president rescinded the emergency state that we're in right now, the emergency declaration, will we still be able to use some of the devices, iPhones and Skype, that we were able to use during the emergency declaration? And at this point, it's hard to answer that question with a definitive answer. We do get a sense that we're not going to go back to what was normal before. And there's going to be, we think that there's going to be an extension or an opening up of these technologies. The exact nature of what that's going to finally look like is a little bit unclear right now. We are working on getting a clearer picture of that. And in about 2 weeks, we're going to be doing a presentation that is directly the impact of telehealth and telecommunication. And we hope to have a little bit clearer strategy. But we do know that there's going to be the post-COVID world will look different. And we'll talk about some of the telecommunication strategies that we can consider moving forward.
All right, in the name of time, I'm going to move on. Slide 21 is what I'm calling the how-to playbook, or the game plan on how to take advantage of all the provisions in the CARES Act and the government declarations. So again, at the risk of repeating ourselves, we want to just cover a few things here that we've talked about before, but I did want to make a point that the blanket waiver does not require a request notification. So you're automatically going to benefit for all the provisions in the waivers, the blanket waivers that were issued in early March. And then we talked about the EIDL loan application. We're recommending that you submit that immediately, use the application hyperlink that we've got there, and get that process underway. I would also recommend you download the PPP, Payroll Protection Program loan application, compile the necessary support information, and talk to your banker. Your bank's going to need to help you with that loan application. The form is provided in the hyperlink, but the discussion with your banker should be about the PPP loan and the SBA Express Disaster loan. Larger employers should evaluate their qualifications for the Treasury Department's Economic Stabilization Fund. Again, we're waiting for the Treasury to give their final rule and guidance on how to process this stuff. But in the meantime, you can raise your awareness and evaluate. If you're an employer over 500 employees, you can evaluate your ability to take advantage of that. The other thing I'd like to add here that I failed to mention earlier, there are rules about how to determine an employee's size relative to affiliated entities. And so, again, this is a question for your legal counsel. There may be ways around this 500 employee threshold based on the legal structure and ownership structure of your entity, if it's a fairly large entity. So that all comes into play as you're evaluating, participating in the Treasury Department's Economic Stabilization Fund. And then as far as the employee retention credits, you want to download that IRS Form 7200, get that application completed. You can immediately begin deferring the payments of your employer portion of your Social Security tax on a quarterly basis. You'll just submit that Form 7200 along with your quarterly tax filings. And again, your payroll processing company can help you. If they're not sure what we're talking about, then you can follow up with us, and we'll help you as best we can. And then last couple things. I would investigate state-based lending and grant programs. Title V, Section 5001 of the CARES Act puts a ton of money in there for distribution to states to help with this program, to provide additional help. It would be beyond the scope of today's presentation to get into all the various state programs, but I think we put an announcement out yesterday. There was a grant program in Arizona, for example, that became available because the Arizona state legislature passed it, knowing that they had access to this fund. So you can ask us to help you with that, or you can investigate on your own. But there are going to be state-based programs coming out to help with this as well. They may not be as timely as the EIDL loans and some of these other SBA programs, but nonetheless, don't let those fall off your radar screen. And then lastly, assess your telehealth capabilities. The question is, can you quickly take advantage of these expansion provisions? Because telehealth is here to stay. And that should be an added capability in your portfolio or service lines. and capability for all your practitioners. So lastly, we're going to talk about the impact on staffs and our staff that perhaps have been furloughed. There are three big programs that CARE Act provides for them. And the first is the Pandemic Unemployment Assistance. In Section 1102, this is described in detail. The high-level components are basically the states provide 26 weeks. The federal government is now providing those states additional resources to add 13 additional weeks for 39 total weeks of unemployment coverage. This is effective through the end of the year. Most states mandate a waiting week. It eliminates that waiting week. It provides an additional $600 for up to 4 months on top of whatever your individual calculated SUI index is. So these are pretty lucrative programs for anybody that's been displaced as a result of this emergency. The other key benefit here is that these benefits are now open to self-employed independent contractors and those with limited work history. Traditionally, self-employed independent contractors have not been able to receive unemployment compensation. And so these are very big developments for those impacted by the disaster that fall into those categories. You know, the applications for unemployment compensation are all state driven. The states are accepting applications. We are aware that some states are having difficulty processing applications. The counsel I would give to staff is stay on. They got to try almost daily till they can get through, either via the phone or on the website. We are told, and it's a mere fact, that the benefits will be paid retroactively to the furlough date. I know there's a lot of folks that are unemployed or have been furloughed that are disheartened by the fact that they can't get their applications submitted, but they got to be passionate and persevere and try to stay on it until they get through. The second big component of the act is the recovery rebates for individuals. This is the program that the Trump administration has been talking about, wiring cash out to individuals in the next week or two. Should be in the next week or two. Basically, it's $1,200 per person, or $2,400 for married filers jointly. And the recovery rebates use the 2019 tax returns. If you have not filed your 2019 tax return, they have moved the filing deadline to July 15th, I believe. But they'll use the 2018 tax return as guidance on how much your actual rebate will be. And as you can see, they're going to send these out via direct deposit. I wish there was an online link to change your direct deposit, but they're working on that, I'm told, and hopefully they'll have that online here in the next week or so. But there's an additional $500 being paid for each dependent under 17 years old. And then there's a step down provision for folks, for highly compensated folks. There's a reduction of $5 for every $100 of additional gross income over $75,000, or $112,500 for heads of households, or $150,000 for those married filing jointly. I guess it should be pointed out the rebate is not payable to individuals with no children with an AGI of 99,000, or married filed jointly with no children with an AGI over 198,000. And basically, the rebate program cuts off entirely for a married couple with 2 children if their AGI is over 218,000. There's a very good summary of Q&A and what you need to know about this program on the IRS website. I provided the hyperlink there for you if you would need that. But this is a program that's being funded right away, and we expect to see wire transfers into the checking accounts on record for the 2019 or 2018 tax returns in the next week or two. And lastly, the CARES Act amended a couple components to Families First Corona Response Act. Basically, this has to do with how family medical leave is paid during the emergency. The CARE Act basically now states that the employers are not required to pay more than the monetary limits defined in the FFCRA, which that means in English is that employers can now decide if they can afford to pay 100% of the wages. For example, there's a 2/3 threshold that employers are required to pay as part of the FFCRA, and now the CARES Act allows them to pay up to 100% or more if they wanted to. And then as Ken was mentioning earlier, rehired employees are also eligible for paid leave under the FMLA Act as amended by the CARES Act. So very important provision there. And then we talked about the tax credit advances, and it's further defined here in the document. There's more information available on the Department of Labor website that kind of gets into more of the details as to how this program works. But this is another component of the act that could be beneficial to employees and employers alike. Okay, so just in summary, the CARES Act of 2020 is the most significant government legislation in my lifetime. Excuse me, at the risk of repeating myself, I think it's important to once again review the game plan that I would recommend you follow to take advantage of the full advantage of the CARES Act and the government programs. And I'm not going to read these all to you, but there they are. I mean, it's a pretty straightforward game plan. I know there's a ton of information in the act here. If you're overwhelmed, we can understand it. I've been working on this for the better part of the last couple of weeks, but my colleagues and I at Open Minds are here to help. We have a team of experts can help you with this. Just reach out to us and let us know, and we'll do what we can to help you. The next couple slides are additional information, links to information that can help you understand the impact of the CARES Act and the Family First Corona Response Act, and also the National Declaration and the CMS waivers. So there's a wealth of information out there. We've done our best to consolidate this into one presentation for you, but if you need more data, we have it out there for you. And as Mina had indicated earlier, we'll be sending these hot links out with the PDF of this presentation later today. That concludes my portion of the program. We're going to open this up for Q&A, and I'm going to let Mina and my colleagues Ken and Steve help field any questions that the clients may have today.
And thank you very much. That was a wealth of information, and we really appreciate you going through the act to compile all of that information for our listeners here today. I'm going to start with a question. Ken, this references what you said earlier, and we would appreciate if you would clarify and tell us again for if the one question that came in was that they have more, there's an organization that has more than 500 employees. However, they serve at more than 100 locations, and they have not been able to track down whether or not they are eligible for any of the provisions available to large employers with over 500 employees, or if because they have multiple locations, they would fall into some other slot and qualify. What would you suggest they do, or where would you suggest they look?
That's an excellent question. So there's a distinction between brand. So if they have over 100 locations and they're over 500 employees, they probably have a consistent brand that they're using across the communities that they serve. The brand should not be confused with ownership, legal ownership. And so what I would recommend they do is they get with their president or CEO or their CFO and talk about the legal component of how a particular entity that's in a physical location is organized legally, because if there are other owners, or it could be deemed legally a standalone business, even though they share a common brand, they probably would fall under that 500 employee threshold to qualify for the breadth of all the programs that the CARES Act offers. But that's where I would start. Ken, do you have anything to add to that?
No, Tim, I think that kind of sums it up. I would start there as well. I know that there were some exclusions in the legislation for hospitality and food organizations in particular, kind of breaking them away from that 500. But I think in our area of expertise, I think your recommendation to look at how the organization is set up, what the legal entities are, and to seek some guidance on that would be helpful. I would not self-exclude without checking deeper into with an attorney and with the bank on what possibly could happen.
Okay, thank you, Ken.
Ken, thank you for that. And while we have you, I know that you are doing a web briefing for us next week, April 16th, about cash flow management. And I wondered if you wanted to just throw out there, in addition to all of the sources of emergency funding and short-term financial help that's available through government sources, whether you have any advice for people on just sort of a top line, what else should you be looking at to get through this immediate crunch?
Yes, we'll do a deep dive next Thursday into managing cash in a crisis. And what we'll end up doing in that webinar is really looking at internal processes one can do to discover cash within the organization, some best practices to free up cash either by increasing cash inflows or slowing down cash outflow. And there are a number of steps an organization can take around that. And we'll also then look at how do we leverage cash from outside the organization, whether that be linking up once again to the bank with your line of credit if you have that, the steps you should take to secure that now, other collaborations, other opportunities if you're not for profit who you could be reaching out to. So we'll do a deep dive next Thursday into a lot more tactical strategy for things that you can do now in looking at the next probably 6 weeks to 3 months, what can you do to make sure you have enough cash flow to get through the crisis and position for after the crisis moving forward.
Yeah, I'd just like to add, if you're a nonprofit, one of the things I recommend is not relaxing your campaign plans. Individuals and married couples are going to be getting their rebate checks or wire transfers. If you abandon a campaign because you feel that the somber times don't warrant it, that's a campaign where you'll never get that money back. And so if you look at the underlying situation where people will be getting a windfall of some money, obviously they're going to use that to help with putting food on their tables for their families and stuff. Still, that might open up the doors for additional campaign donations. So I would encourage all nonprofits not to deviate from their campaign program that they've established for this year. And in spite of the gloom and doom that may be prevalent in one community or another, I would encourage you to continue with those campaign plans.
And Tim, just to piggyback on that a little bit, the CARES Act does have some considerations related to charitable deductions as well that encourages donors, those that have cash, to be helping organizations like ours that are social service and healthcare organizations. So the CARES Act does include some additional incentive for reaching out to donors and encourage them to contribute.
That is an excellent point. I didn't bring it into today's presentation, but there is a designation that those donations will qualify for a net effect on your adjusted gross income for calendar year 2020. So if you need more information about that, let us know. We'll give you the exact information right out of the Act. Next question then, Mina.
I am waiting to see if anyone else has questions. I don't see any at the moment. I think you've covered most of the ground already, Tim and Ken and Steve. Thank you all. I would encourage people, if you have, those who are listening, if you have any questions, now would be a good time. We'll stay on the line as long as it takes to answer your questions. Please send your questions in using the question box on the right of your screen. But if you should leave today's web briefing and have further questions that you think of, please feel free to send us an email, info@openminds.com, and we will route them to Tim and Ken and the other experts and get your questions answered. Okay, Stephanie, I'm just checking in with you. Stephanie is helping us with the logistics of the webinar today. Are there any questions that I have missed?
I think the main questions have been covered already.
Okay.
Okay, thank you, Stephanie. Tim, any wrap-up comments?
No, I just, again, at the risk of sounding like a broken record, I would get on that EIDL application immediately. I would reach out to your bank, verify that they have an SBA loan program. If they do, that's going to help help expedite your payroll protection loan program, as well as to potentially take advantage of all the other SBA loan programs that can be an emergency infusion of cash during these difficult times.
Okay. And Ken, do you have a sense of when we might hear more about the provisions for organizations with more than 500 employees, or is it just a wait and see at this point?
You know, Mina, things are changing daily. Anyone monitoring the stock market today knows that, you know, it's up about 2% because Chairman Powell said that he would be working with the Treasury Department to get more liquidity into banks, in particular focusing on a Main Street loan program for organizations having over 500 employees up to 10,000. And so I think things will continue to change on a daily basis. So if you fit in that small business administration niche where you can be accessing these funds that we talked about primarily today, I would move ahead with that. If you're over 500, I would look at other options, but I would continue to monitor on a daily basis because the Fed will continue to work, the US Treasury, and we know that Congress will continue. They're working on yet another relief package. And so if we don't see anything today, that doesn't mean that a week from now, there might be more liquidity moving through the bank. What I would encourage you to do is if you're over 500 employees in particular, build that relationship with your banker because those funds will definitely be flowing through a bank. And so now, once again, is the time to pull together your financials, reach out to your banker if you have one. If you don't have a strong banking relationship, build that. They're going to be very busy, but build that now because more funds will be flowing and they will flow through banks.
Yeah, and you're doing a webinar next week. You can provide additional updates as they become available about the Treasury Department program. Hopefully they'll give us some guidance and clarification on how that's all going to work by next week when you do your webinar.
And Tim, just to, on that EIDL loan, I know that they're saying it takes about 130 minutes. At this point, it's been streamlined. It can be done in about 15 minutes if you have your basic business information in front of you.
Awesome. So just to clarify what Steve said there, the initial EIDL application was quite extensive, and I think that they have subsequently consolidated it down to where you're saying only taking 15 minutes now. That's a wonderful development.
Yeah, so it's an important one to get on. I think the other point that for the concern I have is that a lot of these loans are really meant for for human resources. And I would encourage anybody to get these loans to make sure that they look closely at what the potential usages are for these loans. That most of the newer ones are not really meant for infrastructure. So I think you have to be careful about how you have those loans set up and be careful with your audit so that you have a clean audit trail.
That helps. Okay, I think that's a wrap on today's presentation.
Yeah, Tim, Ken, and Steve, thank you very much. And we want to thank all of our attendees for taking an hour out of your day to be with us. We will be in touch with you with all of the links and a link to the recording and the slides through your email. So we will see you at our next web briefing on April 14th, which is about what it takes to pivot to become a virtual service delivery organization. So we would love to see you all back for that. Lots of great information there and some case studies that I think you will really benefit from hearing about. So we'll see you on April 14th for our next web briefing. Thank you all and enjoy the rest of your day.